Welcome to AMDA on the Hill, your periodic update on AMDA's public policy activities. My name is Alex Bardakh. I'm the Director of Policy and Advocacy here at AMDA. Just wanted to update you on a few things as we get going here in the new year. Obviously, a lot of the attention as we started the year in Congress was focused on the ongoing impeachment hearings that have taken up a lot of the airtime on what's going on. However, that's not the only thing happening in Washington, and we continue to work with Congress, with House and the Senate on several issues of importance to AMDA. One of them being the role or the use of antipsychotics in nursing facilities. We continue to meet with staff on Capitol Hill to discuss potential legislation to address ongoing concerns about antipsychotic use. We will see if there is actually legislation introduced, but I wanted you to know that AMDA is being very proactive and is working with a number of other societies to figure out what, if anything, should be done on the legislative angle regarding the use of antipsychotics in nursing facilities. The other issue we continue to address is one that we've talked about quite a bit here in these updates, and that is the ongoing issue of trying to figure out whether or not we can get medical directors listed in the CMS's public Medicare directory. Just recently, CMS put out a blog post and an announcement that they're going to be revamping all of Compare websites, including Physician Compare, Hospital Compare, and Nursing Home Compare. Of course, we view this as an opportunity to relook at this and provide increasing transparency about the role as a medical director plays in the nursing facility and include the public directory of medical directors in the Nursing Home Compare, or whatever the new name would be, as they revamp this. We continue to talk to Capitol Hill, and we continue to talk to CMS about that issue, and I think hopefully we will see some letters or some movement on that front. Lastly, we are addressing the telehealth issue. Telehealth is an important part, we hear, of accountable care organizations and new value-based models. So we're working with Capitol Hill on expanding reimbursement for telehealth services. There's been legislation in the past, and we're trying to get something reintroduced that would provide additional reimbursement dollars for telehealth and lift current restrictions on telehealth use in the nursing facility. We view this as an important step to provide innovation and to provide quality care in the nursing facility. Switching from the legislative angle to the more of the federal angle, I was just attending the Office of the National Coordinator annual conference. Office of the National Coordinator, as you may know, deals with a lot of the health information technology. Conference obviously brings a lot of vendors, a lot of policy makers, Capitol Hill, and others to talk about what direction the ONC plans to be moving in. They just released their plan for moving forward from 2020 to 2025. A lot of what we heard at this ONC annual conference this year dealt with patient access to health records. There's been no secret that this administration and CMS Administrator Seema Verma has talked about this, about patient access. One of the things that we have pointed out is, of course, we support patient access, but of course in our world, in the nursing facility, it's not just about patient access, it's about patient caregivers and their families, who has access to records, how it's actually done. And we'll continue to work with ONC and others to promote interoperability in this sector, to highlight the need to invest in health information, and meaningful health information technology in this sector, and the need for interoperability if we're going to be a successful part of the healthcare ecosystem. So that's just a highlight out of ONC, so I wanted to make sure you know that. Lastly, what I'll talk about is the evaluation of management services. I just came back from another meeting where there was a lot of discussion about CMS's new rules and new codes for evaluation and management services that were put in place in last year's final rule. There continues to be a lot of questions, a lot of education ongoing around the revamped evaluation and management services. As a reminder, those changes affected office-based codes. There are now some new additional add-on codes that are out there. AMDA will hopefully be providing some additional education. We hosted a webinar just before the new year on this, so again, go back and please review that. But we will be doing a little bit more work to provide additional information and working with CMS on some educational efforts as these codes come out. And finally, what will happen with nursing facility codes? It's still to be unknown whether anything regarding nursing facility E&Ms will be done. Right now, the focus, of course, is on office space, but CMS keeps in mind about what the rest of evaluation and management services will look like. Last thing I will mention is that we have kicked off our practice group network. If you have not heard about the practice group network, it has been revamped a little bit from previous years. If you were a part of it, this year any AMDA member can join for a relatively small fee. It allows you access to additional webinars, and we just held one around accountable care organizations, and really the focus there is how to leverage your business of post-acute and long-term care, how to make sure that your practice is surviving from a business standpoint, but also providing quality care. We just held a great webinar on how to find an ACO, how to participate within an ACO. So if you are interested in those topics that go into a little bit more depth about all of these issues, whether it be coding or ACOs or other issues that affect your practice, please reach out to us and inquire about the practice group network, and we'll be happy to provide that information, and hopefully you can take advantage of some of the benefits that it provides. Thank you again, and we look forward to working with you this year, as always.